from a very small town called Barnesville in southeastern Ohio, near Wheeling, West Virginia. Our home was across the road from a big cattle farm, so that was my entertainment as a kid. My mother instilled in me, you have to be able to support yourself. Now, this was back in the early 70s, so, a lot of women didn't work. But she said, you never know if you're going to get married or what. You've got to be able to support yourself. I was torn between wanting to be a nurse and wanting to be a teacher. Then I was trying to decide, okay, where am I going to go to school? I didn't want to go to Ohio State. I was intimidated by Columbus and Ohio State because I was from such a small town. So this lady said, well, if you're not sure about whether you want to be a teacher or a nurse, there's this great school in West Virginia. It's called Alderson Broaddus, small Baptist school down in the hills of West Virginia. So my parents and I went down there and checked it out, and it seemed to fit. So that's where I chose to go, and I chose nursing. So I kind of thought, if I'm a nurse, I can always teach later, thinking maybe that would happen, but not really seriously. So my husband's a coal miner, and his mine shut down. And we weren't married yet. And he had his choice between the state of Utah and Alabama. And I told him, I said, well, I don't know much about Alabama, but what I know about Utah is not going to work for me. So if you want to get married, you better think seriously about Alabama. I noticed that the University of Alabama was here. I had started back at West Virginia University on my master's degree. I was getting ready to do my thesis, I guess. And I didn't want to lose that. So I contacted the college. I wrote a letter and just said, I have kind of half a master's. I'm working on it. I realized that's a requirement, and I plan to finish it. So I did the interview, and then she said, yeah, we'll hire you temporary full-time. Hung around 44 years here. Starting out, being able to be employed here was huge to me. Then being a course leader was huge. And then they came to me and said, we want you to be the associate dean. So, it was a great, great experience. I served 5 years as president of the Board of Nursing. That was huge to me, to be involved in making decisions about people's licenses, about like nurse practitioners, what they can do, what they can't do, moving nursing forward, trying to get more opportunities for nurses, advanced skills for regular nurses, allowing nurses to be more part of the team. Yeah, I think we've moved nursing forward. I am a firm believer that it's my fault as a nurse if somebody doesn't understand what I'm telling them. That has become kind of my, the thing that pulls it all together is the health literacy. I'm a country girl. I don't talk in big words. I'm not going to do that to people. Patients would ask me after a doctor left, what was that? I don't get it. So I'd explain, in just normal words, and it just kept building and building. I had a grant with that. Tried to teach nursing students and graduate students about health literacy. I've done some consulting with health literacy. We had the grant, the federal grant through the Minority Health, and I will always advocate for that. I just think that's what we're supposed to do. Do I think I've had a huge impact on nursing? No. I think I have worked in all different arenas to try to bring change, help people to see what needs to be changed, and to try to get people together, working with community people, working with healthcare providers, working with nutritionists, and all different, kinds of folks. I think that students do remember me and remember what is expected of them, to say, hey, you've got to do a little bit more, and you're going to make a difference in the world. So I would not say I've made a big difference in nursing like vertically, but I think horizontally